Okay, so this one is going to be the hydrocephalus related to Chiari malformation. I could be saying that word wrong. So basically what the Chiari malformation is, it's whenever part of the cerebellum in the brain pushes down through the opening of the base of the skull into the spinal cord. So this leads to blocking the flow of cerebral spinal fluid and puts pressure on the brain and the spinal cord. So what is hydrocephalus? So hydrocephalus is whenever you have too much of the cerebrospinal fluid in the brain's ventricles, and it causes an increased pressure of ventricle enlargement. So how are these related? So in the Chiari malformation, the cerebellum pushes down and blocks or slows down the normal flow of cerebrospinal fluid between the brain and the spinal cord. So because the blocked cerebrospinal fluid builds up in the brain's ventricle, it'll create hydrocephalus. So it's fluid built up due to the fact that the cerebellum is blocking down that normal flow. So that's just kind of like the pathophysiology behind it. So hydrocephalus is whenever the cerebrospinal fluid accumulates due to decreased flow. And this can lead to increased intracranial pressure. So risk factors: congenital malformations, so you're just born with it; infections and tumors. So signs and symptoms are going to be an enlarged head, a bulging fontanelle, and irritability. So the baby's going to be irritable. So treatment and nursing management. You can do surgical placement of an extracranial shunt, and you have to replace it as the child grows because their head is growing, so you're going to constantly replace it. And you want to monitor for infection, and you also want to monitor for shunt malfunction. So in infection, the signs and symptoms of infection of the extracranial shunt is going to be increased vital signs, poor feeding, vomiting, decreased responsiveness, seizures, and inflammation. And then signs and symptoms of the shunt malfunctioning is vomiting, drowsiness, and headache. You're definitely going to want to know these. And to treat the infection, you're going to treat it with IV antibiotics because it's in the brain, so you want to give it to the IV. Make it go all the way up because you want it quick. Malfunction of the shunt can happen because of kinking, blocking, or separation of the tubing. So you're definitely going to want to focus on this treatment nursing management part about the surgical placement, how it is replaced, and then you want to know the signs and symptoms of infection, how to treat it, which is with IV antibiotic, and then the shunt malfunction signs and symptoms and why it can happen. You also want to measure the head often because you can see if it's getting swollen, because remember it's enlarged and the fontanelle is bulging. You want to also educate and support the parents and lead them to support groups. So that is going to be the hydrocephalus in relation to the Chiari malformation.